80% of my students were repeat testers, now they are licensed nurse. My name is Favour. I'm an NCLEX coach and I have helped over 700 nursing grads pass the NCLEX. And here's what is wide. 80% of them had already failed at least once before working with me. So I know exactly what causes smart, capable students to keep failing and what finally helped them pass. In this video, I'm going to show you exactly why repeat test takers struggle and the mindset plus strategy shift that changes everything. Whether you have failed once, twice, or more, what I will show you next can help you finally pass the NCLEX and move on with your nursing career. So right here, I want you to look at the question I have on the screen, right? You can see the question I have on the screen. Now, I want to ask you one question. What do you think of when you see NCLEX question? Now, imagine you are taking the NCLEX now. What do you think of? What's that thing you think of when you see a particular question? When you see your question, because now this is it. I've been coaching for the past 2 years, right? And when I engage with students, right, students that join my coaching program, I always used to ask them to read the question out so that I can see the way they think through the question. Because every question follow a certain, okay, let me just say it like this. Every question require a specific kind of care. The moment you cannot identify that particular care you are giving in that question, it become a problem. Most time, the reason why a lot of students fail is because they don't even understand the NCLEX. The moment you understand the NCLEX, you can read perfectly through your question. Now, the way you answer nursing school question should not be the same way you answer NCLEX question. I'm going to break this question down for you, and you're going to see that even with little knowledge, you can still be able to answer question in as much you can think like a nurse. In as much you can easily figure out the examiner what mindset. Right. So there's two things I teach my students to do. One, how can you think as a nurse? Two, how can you figure out the examiner mindset? Because every answer talk about a specific thing that the examiner is thinking about. Now, let me give you the approach. Now, NCLEX want to test your ability to what? Practice, and also want to test your ability to show that you are a safe nurse. So in order to show that you can practice, NCLEX provides you practice areas. So these practice areas are related to what we call the 8th category, 8 client need. Now, if you have failed the NCLEX exam before, if you check your test plan, you are going to see the first 8 category, right? That you add either above, below, near before you see that part that stated clinical judgment, and then you have 6 other items listed, right? That 8 category, we call it the 8 client need. That is the practice area at which the NCLEX is trying to test you on. So each of these 8 client need have specific content. That is the main reason why I wish to say the content for RN is 146, the content for PN is 150. Right. The content for RN is 146, the content for PN is 150. Now, if you fail the NCLEX exam before, you are going to see that 8 client need listed. So that's where you are going to say, oh, I had above in this area, I had below in this area, I had near in this area. Now, if you go on the NCLEX test plan, because I always used to tell my students, you can decide to use the test plan and pass the exam, or you can ignore the test plan and then keep failing the exam. You get to decide. Now, but one thing I know for sure, if you have a good program and you utilize your NCLEX test plan alongside with that program, you are definitely going to pass the exam. Do you know why? Because you will know where the program is going wrong and be able to fix your direction. Because most people use a particular program, they don't even know if the program is going wrong for them or not. Every program, right, in as much the program is credible, they are good program, but trust me, everybody have specific needs. Right. A particular student, the only thing they need might be just question. Another student, what they need might be content. Another student, what they need might not even be question. What they need might even be how to break down question. You see, there's one thing for you to look for question to answer them, and there's one thing to learn how to break it. Some people, they know how to break question, they just need to expose themselves to many questions. But there are some people, they have access to question, but they don't know how to break it. Right. There are some students, they have access to content, but they don't know how to understand or retain the content. You see, everybody have different problem. But guess what? Everybody don't try to fix their problem. They only try to fit into what is making people pass. And that's where the problem come from. Now, student A is telling you, oh, I use this particular program to pass. Student B is telling you, I use this particular program. Student C is telling you, I use this particular program. Did I say program or problem? I'm talking about program, right? Now I use this particular program to pass. Now you that you are right here, you are not thinking and you are not like, oh, if this particular student can use this program to pass, if this particular student can use this program to pass, if this particular student can use this program to pass, then I have the ability to pass. So you avoid your problem that you have and you focus on these people testimony towards this program. Now these people testimony don't guarantee you success. It's your problem that the program solve that guarantee you success. If the program is not solving your problem, you are going to use that program that student A use, student B use, student C use, and still fail. That is the reason why you can see a good program, and then some people are using that same program to pass, and some people are using that same program and they fail. Now look at it. Let us give an example. Let us say boot camp, right? Let's give an example. Let's say boot camp, right? Now, boot camp can have maybe like 2,000 questions. I don't know, but let me say minimum 2,000 questions. Boot camp, right? If you are meeting me for the first time, let me tell you something about me, right? This is what I do. I understand the NCLEX so well that I can make somebody that is struggling, right? Even if you have failed the NCLEX exam more than 10 13, 14 times, I can still be able to make you pass because there's three things that is holding one back from passing the NCLEX exam. Now, one is the content, two is knowing how the NCLEX write the exam, three is understanding how to break the question. Now, if I can do these three things with you, you will never fail the exam. Right, this is the transformation I want to give to you. Now, when I want to do content with you, I only utilize content written by the NCLEX writer. So what are the NCLEX writer? We call them the NCSBN. Now, when most students finish nursing school and they are thinking about how to pass the exam, they don't even know these guys. These are the writer of what? The NCLEX exam. These are the writer of the NCLEX exam that provide you material in order to succeed on the NCLEX exam. But most people ignore these guys and they focus on what? Question bank program. So who is writing the NCLEX exam? Is it your question bank program that is writing the exam or the NCSBN? So if I'm to choose who to learn from, am I going to learn from question bank program that don't write the NCLEX exam, or I'm going to learn from NCSBN that write the NCLEX exam? Trust me, I'm going to learn from who? The NCSBN. So I only utilize information from the NCSBN, right, related to the content, which this NCSBN created what? The NCLEX test plan. So they created the NCLEX test plan. So this NCLEX test plan contain information that will be on the exam. We have the NCLEX test plan for RN. We have the NCLEX test plan for PN. We also have the test plan because this exam body, they write exam for NCLEX-RN, NCLEX-PN. They also write exam for the REX-PN as well too. So they have content for these three exam and they are written the same way. Written the same way, have similar content, right? Just little changes but similar content. Each of these exam have 100 plus content. So I focus on the content written by what? The examiner, because they are the one writing the exam and they have given out the content that will show up on the exam. And guess what? It's the CAT, right, that is distributing questions related to this content. So the computer cannot make error by giving you questions that you are not familiar with if you have covered every information on the content, right? That is the main reason why my students will go on the NCLEX exam, and the uh, exam will look like another practice test to them. Now, the next thing you will now learn is how the NCLEX write the exam. Imagine you know how something is being done perfectly, right? Guess what? Are you not going to do well with it? 100% you are going to do well. So this is the ability that I want to give to you, learning how the NCLEX write the exam, right? And how the NCLEX write the exam have been explained many times by the NCLEX writer, right? But you might have missed it many times. But right now I'm going to teach you that how the NCLEX write the exam. Because the moment you know how the NCLEX write the exam, you can even in your mindset be writing any question. In your mindset, you can be writing any question related to any content that you are learning. That is the power of knowing how the NCLEX write the exam. Now, if you know how the NCLEX write the exam, when you go on the NCLEX exam, you are not trying to figure out the question out. You already know what the question is asking. When somebody is trying to figure out what the question is testing, you know what the question is testing. So that gives you the ability to be able to answer the question perfectly. That gives you the ability to be able to understand it and break it down perfectly. Right now, at this point, I start introducing you to questions. Right now, remember I was talking about boot camp. I don't know what is in boot camp like that, but guess what? The reason why is because I don't pay attention to question bank program. I pay attention to the NCLEX what past questions that have been tested previously on the exam. This question, if I teach it to you, you have the ability to see the same thing on the exam and think the same way on the exam. But if I'm teaching you related to question bank, some question bank questions are not related to the writing style of the exam. So that way, there's no how I can teach you, and then you go on the NCLEX exam, you see a different thing, and you come back to blame me. But I want you to go on the exam, be able to see the same exact thing that I'm teaching you, and then when you go on the exam, then the exam look like another practice test. It look like you are just it just looked like somebody is telling you the answer, but you are really answering the question. But the reason why you are able to answer the question successfully is because you understand what you are doing, right? That's the power I want to give to you. That's why I don't use question bank. I don't discourage question bank, by the way, but I use NCLEX past question, right? That way, with the content, the knowledge of how the NCLEX write the question, you can be able to break down questions. So this is the three things that hold student back. It's always these things. Is either the content right to understand, right? So that is it now. So let me paint this out. You are using bootcamp, right? Now, your friend used the bootcamp. You as well use the bootcamp. Guess what? It's the same question that you are doing. It's the same question that your friend is doing. You finish all your 2000 questions, your friend as well to finish all the 2000 questions. So now, if the only thing that might change is that maybe your exam date is on the 29th, right? And then maybe your friend exam date is on the 1st. Now, the only difference is that your friend is taking what the exam before you, or you are taking the exam before your friend. Now, let us say this is your friend, right? Let's say this is your friend and this is you. Now, your friend took the exam, she passed, right? Using bootcamp. Now, because you both answer the same question, you should go on the NCLEX exam and also be able to pass. But guess what? You end up now failing. Now you are now asking yourself, why did you fail? Guess what? Your friend used that same 2000 question. You as well too. You use that same 2000 question, but your friend passed and you fail. So what is the problem? You attained 80% high chance of passing your NCLEX. Your friend as well to attain 80% high chance of passing the NCLEX. So what is stopping you from passing? What is stopping you from passing? Now, let me tell you what is stopping you from passing. One is your knowledge. What do you know? Right? Related to what? The content. That is one. Because question bank don't teach you content. Question bank give you the ability to test yourself in answering question. Content and question is a different thing. You can learn your mistake from question, but the mistake you are learning from question don't give you a full overview of a specific content that you are getting question wrong from. That is the reason why a particular student answered the question related to SIADH. Now, she was answering question related to SIDH. Now, let me explain the problem. Now, she answered the particular question, and the question was like, which of the following order should you question? Right? And one of the other was related to giving fluid. Right? Now, she selected that particular answer. Right? She got it correctly. And she was like, oh, coach, I got this question correctly. Your method helped me to answer the question successfully. I said, oh, okay, great. Now, She saw this same question again, another question, SIADH. And the question was like, which of the following, see the same uh, examiner question, which of the following order should you question? Then she selected fluid again as that answer, but this time around she got it wrong. Now, do you know what she did? She screenshotted the question and she sent it to me. And she was like, coach, is it that this question bank, it was from bootcamp. She was like, is it that bootcamp made mistake in this question? Because this should be wrong. Now, when I looked at the question, I said she should send the previous one to me. Right? She sent the previous one to me. Then, and I noticed the problem. Now, with SIADH, right? Because they have fluid overload, they are trees for what? Low sodium. Right. Because they are trees for low sodium, guess what? We need to replace their sodium. So we give them fluid, but it depends on the kind of fluid, right? We don't just give them any kind of normal saline. No, because there are some normal saline that we add more fluid to the existing overload that they have. But there are some kind of fluid that we only replace sodium without not adding fluid to the body. So that's the mistake. So she was not able to differentiate with the fluid that we know cause more fluid to the patient. That's the problem. So you can see, despite the fact that she understands the rationale from the previous question, it was not able, the previous rationale did not help her in answering the second question. You can see the problem now, because now you answer different questions, you feel like you are ready to take the NCLEX exam, and now this is the problem. NCLEX don't have fixed question. Your question bank program have just fixed 2000 question. That's why your friend did the same question, you as well to you did the same question. But on the NCLEX exam, the question that your friend will get will be different from the question that you will get. You understand? So NCLEX don't have fixed question. NCLEX have different question for different individual. So the chances of you seeing any of these 2000 question on the NCLEX exam is extremely low. Is extremely low. For the past 2 years, right? I've been asking students, and if you are listening to me right now and you've taken the NCLEX exam, please answer this question in your mindset. Now, I've been asking students this question. From every question bank program you have been using, how many of the questions did you see on the NCLEX exam? Now, the highest I've heard from a particular student said she saw 8 of what she practiced on her question bank on the NCLEX exam. Now, 8 minus, I'm sorry, 85 minus 8, you are going to get 77. Meaning 77, she did not, 77 of her NCLEX question, she did not see that on the particular question bank program. She only saw 8. So is 8 able to make that student pass the NCLEX exam? Obviously, no. Meaning she only knew 8, she have to figure out the remaining 77 herself. Now, guess what? This student's exam did not stop in 85 question, right? Her exam stopped in 135 question, meaning she only saw 8, right? She only saw 8, and then she did not see 127 related question to the question bank. You can see. So that's why I tell students, if you use a question bank program to pass the NCLEX exam, it's not the question bank that make you pass. It's the existing content knowledge that make you pass. Because there's no guarantee that when you use a question bank program, you are going to see same thing on the exam, because that is how most students think. They want to use a particular question bank program, right, and see those questions on the exam. It don't work that way. The only reason why you are using a question bank program is to test your ability to answer questions. It's your ability to answer questions that you are trying to test. Your ability to challenge yourself to most content. Maybe you don't know it. Maybe you are trying to look for a way to answer questions when you don't know most content. Maybe, sometimes you might try like that and you'll be able to answer question. But my core belief is, one, you need to understand content, right? You need to now have what? Knowledge. When you have the knowledge, then you want to what? Start answering question. When you have the ability to answer question, that's when you want to start introducing strategy. Strategy make you lazy. If you don't work in this format, right, it will give you problem. Then all doing all these things together, then make you what? Acquire what? Success. You can never go wrong. This is your roadmap to success. Content, creating knowledge, question, strategy equals success. This is how students under my coaching program pass with minimum question, which is 85, right, on the NCLEX exam. So when you see question, right, what do you think? You understand? When you see question on the NCLEX exam, what is your thinking? You understand? You need to understand the pattern of care related to the NCLEX. What kind of care is the NCLEX requiring from you? Now, let me tell you the two type of care that we do in nursing so that you can be able to think through every question. At least if I give you this for free, maybe you are going to see a reason why you should learn more from me in my coaching program. Right. So now there's two type of care. So when you want to think about your question, it's always these two things, right? Think about this. This is you, the nurse, right? You offer these two type of care. You offer internal care and you offer external care. Now, internal care is related to the client's body. So let me just put body, right? Internal body, right? So like maybe you are trying to make sure to see if they are stable, what, or unstable. Right. So everything we are dealing with is related to the client body, whether you are doing treatment, procedure, condition, everything is related to the client body. But external care is related to what? The ethical part of the client. Right. So external care is related to the ethical part of the client. It's more for the client and little for the nurse because you still have um external care is related to ethical part, right? So you still have ethical duty as well too for yourself and also for the client. Now, for the client, it might be confidentiality, privacy, client need, client right, advanced directive, different related things that are not related to giving a patient medication, any kind of treatment, procedure, condition. It's not related to all that. It's just trying to deal with the ethical aspect of the client, right? So now, this area on the exam is tested 70%. This area of the exam is tested 30%. Right. So now when I look at my question, I'm going to ask myself, am I dealing with the ethical aspect of nursing or I'm dealing with the client itself? The body of your question will tell you. Now, I don't know if you are hearing me for the first time, but if you are hearing me for the first time, I always used to tell my students that every NCLEX question have 3 parts. You need to know that because that is how the NCLEX writes the question. So you need to know that, or that is how the examiner writes the question. Remember, the examiner is who? The NCSBN. So every NCLEX question have what? 3 parts. We call it the body, the stem, and then we have the answer keys. Right. The body, the stem, the answer keys. Now, the body of your question contains the content. So if you have gone through the NCLEX test plan, right, you are going to find out that NCLEX-RN have 146 content, NCLEX-PN have 150 content. So if you have gone through the content, anytime you see your NCLEX question like this, the first thing you are looking for is the body of that question so that you can figure out the content, because the content gives you the thinking ability while preparing your mindset for the stem, which the stem is the examiner question. So the stem is the examiner question that tests you related to what the content is trying to test you. There's one thing to know what will be tested, and there's another thing to know how it will be tested. Most students know what to be tested, but they don't know how it's going to be tested. Now, let me teach you what will be tested and how it's going to be tested, right? Because that's another important thing you need to know. I will keep saying this in every video. The reason why I'm trying to create a particular awareness, right? Because most students struggle on the NCLEX exam, and I want to create a particular roadmap that can help you out in navigating every NCLEX question. Now, when the NCLEX is writing the question, NCLEX write the question related to 2 things that they want to test. They want to test your ability to be able to practice. They want to test your ability to be a safe nurse. So the practice area is where they pick the content from, right? It's the 8th client need. As I said, if you have gone through your test report after failing the exam, you will see this content where you are below, above. Yeah, they are content related to each of those category, right? And that's why I said the content for RN is 140, because when you count those content related to each of those category, they are 140 for RN, 150 for PN. Now NCLEX will pick one of those content, right? So now let us say, for example, let us say NCLEX want to test acute. Okay, let's say NCLEX want to test acute and what? Chronic condition, right? Now NCLEX is now going to test you related to safety. The safety part is the sixth concept. Now, the six concepts include caring, nursing process, communication and documentation, clinical judgment, culture and spirituality, teaching and learning. Right. So that's the six concepts. If I mention it, let me just write it so I will show you six. Right. So caring, clinical judgment, nursing process, communication and documentation, culture and spirituality, teaching and learning. So 1, 2, 3, 4, 5, 6. All right, that's six. Right. The practice area is your management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, right? Basic care and comfort, pharmacology, reduction of risk, physiological adaptation. 1, 2, 3, 4, 5, 6, 7, 8. There are 8 client needs. So each of these client needs, they have content in them, right? They have content in them. So if you count each of those content related to each of them, you will get 146 for RN, because it's RN that use management of care, right? Rex PN also use what? Management of care. But NCLEX PN, NCLEX PN don't use management of care. NCLEX PN use coordinated care. So if you, but everything is the same, but it's only coordinated care that is not the same. And another thing that is not the same as well too is the pharmacology part, because on the NCLEX RN, NCLEX is trying to test you related to pharmacology and the parenteral aspect, right? But for coordinated care, based on your scope of practice, NCLEX is not testing you related to the parenteral aspect. It's just related to what? Pharmacology itself. And maybe you are trying to monitor something, but you don't carry out the parenteral aspect. You maybe monitor it, yeah, something like that, right? So yeah, so that's just the uh little difference between the two. So they pick a particular content and test related this concept. This is this concept that make you a safe nurse. So if you are trying to learn and succeed, if you are trying to succeed on the NCLEX exam, this is, I will not say this is the biggest thing you need to know, because I cannot really tell you if this is what you need to know the most or this is what you need to know the most. All I can just tell you is that the two are 100% important: the content and the concept. Most especially if you know the content, that is you knowing what to be tested. If you know the concept, that is you knowing how it will be tested. That is why I said it's three things that make you succeed on the NCLEX exam. One, the content, knowing how the NCLEX write the question and trying to understand it. If you know these two things, it's very powerful in a way that when you go on the NCLEX exam, right, I'm telling you, the exam will be tired of you, that you have no choice than to stop your exam in 85 questions. This is the power I want to give to you. Right. There's little I can say on this video, right? But trust me, these are things you need to pass if you have struggled, right? I use the same principle: content, knowing how the NCLEX write the question, understanding the question with a particular student who failed 14 times and passed on her what? 15 attempts. Right. So if she can do it, a student who studied in Philippines, international student who struggled with English, and she was still able to pass the exam, despite she said her problem was she don't understand so much of the English. That is the reason why she's failing the exam, right? So what about you that understand something? So what's holding you back from passing? Nothing. The only thing that's holding you back from passing is the lack of understanding of what you need to know. So you need to get a coach that can easily now tell you this is the problem, this is the problem, see what is the problem, and then be able to help you out navigate it through. Because most people feel like this is what they need, whereas that is not what they need. They, there is another thing that they need to help them pass, right? When you go to the doctor, right? When you go to the doctor, did the doctor just give you treatment instantly? No. When you go to the doctor try to what? Assess to see what is your problem so that they can be able to give you the best care. That is the reason why I call myself the NCLEX doctor. Because what I do is not to just throw material on you. Instead, I try to find out what is the problem. Like, if you message me now, you like last week, more than 40 students reached out to me in order for me to help them pass the NCLEX. The first thing I always used to tell them is I would like to meet with you on Zoom so that we can discuss how I can help you pass, because I need to know how I can be able to help you pass. The way I'm going to help a particular student pass is different from the way I'm going to help another student pass, because what you know and what another student know are not the same. That is the reason why two people can use the same question bank program and one is going to fail and another person is going to pass. Despite the fact they are answering the same question and they are taking the same NCLEX maybe RN exam or the same NCLEX-PN exam, and they still one pass, one fail. So what is making one to pass, what is making one to fail is the knowledge that the particular student knows. So if I can be able to know what you know, and I'm able to tailor it to what the NCLEX expects you to know, and I see it's not enough for you to pass the NCLEX exam, I can start directing you the right path immediately. Because one thing I know about myself is that I want your passing result, and one thing I know about you is that you want to pass. So we have shared goal, right? You want to pass, I want your passing result as well too. Because I've seen a lot of students giving up, and I want to make sure that your testimony is making another person not to give up. So that is the reason why I'm doing everything I'm doing in order to like help you out in passing the exam. NCLEX is not difficult. You just need to see another way of thinking about it, which I'm about to show you in this question. Right. So this question is testing you what related to acute condition. Like I said, this is one content that the NCLEX speak out of 100 of content, acute and chronic condition. So how do I know this is acute and chronic condition? Because it's a condition right here. It's a condition right here, and it's acute condition. You understand? So since I know, right, NCLEX can either test you on chronic acute condition, but you just need to pay attention to the fact that it's condition that NCLEX is testing you. One, it's not external care, it's internal care because it's have to do with condition, right? But now, since it's related to acute or chronic condition, you can decide to fix it into one of the two. No, yeah, if it's important for the question or not. Most times it's not important, most times it's important. It depends on if NCLEX is asking you something relevant to that. But 90% of the time is not important, right? That's what I want to just say. Now, so since I know it's acute and chronic condition, what the NCLEX expect you to know about acute and chronic condition is the pathophysiology to the condition and then the body system affected. That's the main reason why I always used to tell students this. You need to know your vital sign and you need to know the body system, the 10 body system, and you need to know how to assess each of those body system for abnormalities. Right. What is normal and what is abnormal? Because that is how NCLEX tests to see you are a safe nurse. Because these are things that you need to know to find out if your patient is stable or not. Most students don't know the difference between hypoactive bowel sound, hyper bowel sound, and absent of bowel sounds. Most students don't know about it. The last time I was trying to break down this concept, I said a patient that is having low respiratory rate and a patient that is having increased respiratory rate and a patient that is not breathing, which one is more important? Because a particular student at NCLEX added no bowel movement, right? Now, NCLEX added no bowel movement, absent, active bowel sound, and hypoactive bowel sound. I said which one is critical in this for information right here. Now, most students were saying, maybe no bowel movement because it will be dangerous. I'm like, okay, maybe because this is what you are saying. Let me give you a clearer concept so that you will be able to understand what I'm saying. Now, a patient have low respiratory rate, another patient have increased respiratory rate, and another patient is not breathing at all. Now, tell me which is very important, right? Which is very important. Obviously, the patient that is not breathing is very important because even if that patient is having low respiratory rate, they are not dying yet. Increased respiratory rate, they are not dying yet. But that no breathing is a problem. Now, hypoactive bowel sound still means that you still hear sound, but they are low. Hypoactive bowel sound means that you hear the sound, they are hyperactive. This is very good. Now you have absent bowel sound and no bowel movement. Now the problem is this: no bowel movement and absent bowel sound is two different things entirely. Now you can have a patient that is having silent breathing, which everyone should have. Like now, you cannot hear me breathe, right? But if you are hearing me breathing with effort, then I'm like, now you can hear me breathe, maybe through my mouth, my accessory muscle movement, and all that kind of stuff. You are seeing me that I'm having a stressful way of breathing, right? So Now, what I want to pick out is this: no bowel movement does not mean you don't have bowel sound. Absent bowel sound is a problem. This is dangerous. So no bowel movement does not mean you don't have bowel sound, right? If a patient tell you they have not been able to pass through for a long period of time, your next assessment should be to assess the abdomen, right? You want to listen for bowel sound. Why are you listening for bowel sound? Because if there's absent bowel sound, you automatically know there's a problem. So most students don't even know the difference between all this. And I find it difficult when students say they don't know it. Do you know the reason why? Because these are your important tools in nursing. And you did this when you were in nursing school. But how managed did you forget about those things? It only means that when you were in nursing school, you only cared about passing each classes. You did not care about mastering the content. That's the reason why it's a problem for you on the NCLEX exam now. That's the reason why it's a problem. Because what you could have been thinking of right now is these are your tools. Because NCLEX can test you related to vital sign anytime, anywhere, in any answer case. So you need to know your vital sign. Body system as well too. You need to know your body system. You need to know how each body system affect one another. The most important body system, you need to know it. That's why in my coaching program, there's one particular part of my coaching program related to prioritization. I have a PDF document on it, right? Because I was explaining a lot of things in different videos. So I always used to refer students to that particular PDF document whereby I listed the category of the body system. I'm going to give it here for free, right? I just want to, give you little value so that you can be able to learn. Now, there are 3 levels to the body system, right? We have level 1, we have level 2, we have level 3. Now, level 1 is what we call the CNR. That's your cardiovascular, neurological respiratory, right? Now, level 2, you have your GI, you have your endocrine, right? You have your renal system, you have your immune. So if you can't see that, 7, and then the last one will be your reproductory, your musculoskeletal, and your integumentary, which is your skin, right? Now, so you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that's your 10 body system you need to know. Now, in this level, now when you are seeing any particular question, and then your question is like, which of the following require immediate follow-up, immediate action, immediate intervention? The first thing I always used to think is there anything related to CNR in that answer? If anything is related to CNR, I'm like putting full stop in front of those answers. Those are those answers I will prioritize first to see if there's life-threatening situation, because these 3 body system can kill the patient fast. This other body system will take time to kill the patient. Then this last one will take longer time. Now, guess what? These 3 body systems, the reason why they are level 1 is that every other body system needs to affect these 3 body system before a patient can die. So that is another lecture for another day. I don't just want to make the video to be long, but before any patient can die, right? All this level 2, level 3 body system need to affect cardiovascular, neurorespiratory. Now, let me give you one example. Let's talk about GI. If a GI patient is having diarrhea, the patient will not die yet. But guess what? If the patient start losing electrolytes, what will it affect? It will affect what? The neurological system. Then the patient, if you don't attend to that patient, the patient is at risk for what? Dying. Now, let's think about the renal system. Renal system patient is having low urine output, patient will not die yet. But when they are having buildup of toxic material in the body and it's now going to the neurological system, start causing neurological problem, patient can die soon. Right? Now let's even go to level 3. Let's talk about multiple musculoskeletal, I mean. Right? Now let's say a patient have fracture. We expect patient to have pain, right? Patient cannot die yet from pain, right? But guess what? Let us say the patient suddenly develop shortness of breath, right? Petechiae, right? Guess what? We are thinking about what? Fat embolism. So look at what happened. Then the the musculoskeletal problem, which is fracture, cause what? Respiratory problem, and patient is at risk for dying. But it all started from musculoskeletal problem. You can see how a musculoskeletal problem can cause what? problem to the patient. Like, let's talk about skin. Now, skin, let's say a patient have skin infection, have not been treated for long, then the infection find its way into the bloodstream, then it cause sepsis. You can see that skin infection did not kill the patient initially, but it had to like go to the bloodstream, right, before it started affecting the cardiovascular. So every other body system have to affect this level 1 for a patient to die. So this is how I teach my students to prioritize. Now, when the patient is still having their sign and symptom related to the body system, you don't prioritize it. You understand? You don't prioritize it. When they are still having their sign and symptoms related to body system, you don't prioritize it. Look for the patient that is experiencing something outside their body system. That's the main reason why you want to know these three things: your vital sign, your body system, and what are they calling it? Health assessment related to each body system, so that you can be able to identify when a patient is having a particular condition related to a particular body system, and then ask yourself, what is this patient experiencing, right? Ask yourself, what is this patient is experiencing, and then check it if it's outside that body system. For example, let me give you an example real quick. I'm giving a lot of value in this video, right? If you are enjoying all this value, please support me, right? Share the video, like, right? Invite people that are struggling with the NCLEX exam. So this is how you can be able to support me, right? So now, take for instance, a patient is having heart failure, right? This is heart failure, right? Now, this heart failure is related to what? The cardiovascular system. Now, the patient is having shortness of breath. Do you know that on a normal day, cardiovascular don't have any symptom as shortness of breath? The owner of shortness of breath is the respiratory system. So now I will be concerned about this patient, because a patient that is having cardiovascular problem, I expect them to have issue with their blood pressure, their heart rate. You understand? Blood pressure, heart rate, maybe with fluid, because yeah, if there's uh slow movement of blood, it can cause buildup of fluid, right? So I expect them to have pulse issue. Okay, I talk about heart rate already. I expect them to have capillary problem, capillary refill, all those kind of things, right? So these are the things that I expect this patient to have, right? But now, because all these things that I mentioned right now are related to the cardiovascular system, but when patient is now experiencing what? Dyspnea, shortness of breath, then it has started leaving cardiovascular related problem, and it has started as affecting the respiratory. So now this become a problem, because if you delay care for this kind of client, this patient will die. Because now the problem is not only affecting the cardiovascular, it has started affecting the respiratory. Now, if the NCLEX is not telling you the patient is anxious, now it's now become a bigger problem, because now this is related to neuro. It's not affecting the neurological system. You see what I'm saying? So this kind of patient, this is the kind of patient we always used to say they cannot wait. When people are saying who is going to die first, this is how nurses who pass the NCLEX exam in its 5-question thing. And I want to give you this unique way of thinking, and you can get that when you join my coaching program. I promise the same thing that you are getting here, same thing you get in my coaching program, right? In order to make you pass, right? Because my goal is to give you the transformation you need, right? I want to change you from I don't think nursing is from me, it is for me, to I passed the NCLEX exam coach, right? Because most people have told me, I feel like nursing is not for me. What do you think? I've done the NCLEX exam 3 times. Do you think I should give it a try again? Right? I say it's not about me telling you to give it a try. It's about you trying to change your dream. Are you ready to become a nurse? Yes. Do you see yourself caring for patients? Yes. So what is holding you back? The NCLEX. Let's fix that. Um, pay for the 60-day program and let's do this. Paid for the 60-day program. After 60 days, took the NCLEX exam. She passed. Right. So I want to give you that same transformation. Someone in a way that you are thinking about, can I pass? I struggle. I want to change that thinking to a new statement at the end of 60 days, right? At the end of 60 days, you will now be telling me, oh, coach, I passed. Oh, thank you for your help, this and that. You are God sent, all that kind of good stuff, right? It all comes from understanding what you need to know about the exam. So these are your basic things you need to know. So if you don't know these things, trust me, don't go and take the NCLEX exam. Don't waste money. Don't waste money. Don't waste tears, right? Don't waste your tears. Don't waste, don't pressure yourself, right? Know what you need to know before you go take the exam. Nobody's rushing you. Right. People say take the NCLEX exam because you will forget about a lot of things. What do you know that you still want to forget? What do you know? That's the first thing. What do you know that you want to forget? What do you know? It's somebody that knows something that will be thinking about what they want to forget. You obviously know yourself, you don't know, and you allow people to pressure you. Why? Now, this question is testing you related to acute. We need to know acute chronic condition. You need to know, okay, what's the pathophysiology, what body system is affected. Now, this condition what cause pouches in the colon. Right. So pouches in the colon, something like this. Let me just figure out a particular drawing. Let's say this is the colon. These are the pouches right here. Right. Now we now know what the examiner is testing, and the body system that is affected is the GI. Right. We now know what the examiner is testing. We now need to know how is the examiner testing it. So an examiner is testing related to the concept we call teaching and learning. Now you would have seen this. If you have taken the NCLEX exam before, you will see the NCLEX using statement like the nurse is talking, the nurse is teaching, the nurse taught, staff education program. Now, these concepts are related to teaching and learning concept. This writing style are related to teaching and learning. Now, if the NCLEX is saying the nurse is talking with a client, it means that when the examiner will ask you the question, the examiner will test you related to the client statement. Right. Like take my word for what I'm saying. Now, if you're taking the NCLEX exam before, you will find out that what I'm saying is true. Right? But if you do not pay attention to this information when you had your NCLEX exam the last time, it means that you have a bigger problem. Because now the problem should be that you are able to remember most of the way NCLEX write the question, but the problem is you are unable to answer it. But now if you are not able to remember the way the NCLEX write the question, you've taken the NCLEX exam 1 times, 2 times, 3 times, and you are telling me you did not see something related to NCLEX testing about client statement, then there's a bigger problem. Then you need a bigger help. Right. Now, but obviously, I just want to believe that, yes, what you are saying when you are listening to me is that, yes, I saw question related to that because NCLEX test 85 question related to that 6 concept I mentioned. So there's no how you are not going to see any of that concept on the exam. It's there. NCLEX is not changing the concept. The only thing that is changing is the content. So this concept will not change, right? The content is just the one that is changing. Because NCLEX don't have many concepts, just 6 concepts they want to test, but we have 146 content for RN, 150 content for PN. So the content can change, right? But the concept, they still remain the same. Now, if NCLEX is testing related to teaching, it means that the teaching has not been done. So the question will be testing you to include something to the teaching. That is the reason why you can see the examiner saying you should include information to this teaching because the teaching has not been done. Now, if the NCLEX is testing related to thought, it means that the teaching has been done. So the NCLEX wants you to evaluate the client what statement as well too. You can see statement. So talking NCLEX will test you related to statement. Teaching teaching NCLEX will ask you to include statement, include information. I mean, why thought NCLEX will ask you to evaluate statement. Now, staff education program, NCLEX will either test you to include or evaluate the learning. You understand? Evaluate what you learned or something like that, or correct understanding of the teaching. Right. So that is what NCLEX tests. So all these things, I believe you have seen it on the NCLEX exam. Don't even tell me no because it's there. That's how NCLEX writes the question, right? So now, understanding how the NCLEX write the question. So we now know what the examiner is testing us. The examiner is testing us related to teaching. Now, we are going to relate this teaching to what? Our knowledge of what? Diverticulosis, which I have spotted out on the screen. It's a condition that causes what? Pouches around what? The colon. And it's a condition that affects what? The GI. So, initially, we have already learned about vital sign, we learned about body system, we've learned about um uh assessment related to the body system. Now, the next thing you are learning is your acute and chronic condition because now we now know the vital sign that can make patients unstable or stable. We know the body system. This is how the patient operates, how they function, what can be a problem to each of those body systems. We know how to assess it. So the next thing we now need to be learning about condition. It's just like right now, if you are and if you are like a phone repairer, right? You initially you don't know how to repair phone, so you went to learn how to repair what phone, right? You learn how to repair phone. Now you've learned already. Now you have a location that you now repair the phone. So what is remaining right now is to start getting what? Customers, right? To bring their phone for you to repair. So now you know your virus sign, you know the 10 body system, you know how to assess them, you know what is abnormal versus normal. So now you have the ability to start seeing clients with different conditions. So the next thing you are trying to learn are the conditions. So you want to learn conditions related to the body system. What are those conditions related to? The neuro, cardiovascular, respiratory. Now this is what I tell my students to do. Learn 10 condition times the 10 body system. So 10 per one body system, right? Commonly tested one, because NCLEX only focus on the commonly tested. Should I say commonly? Yeah, commonly tested one is what you should know on the NCLEX exam, right? NCLEX focus on the condition that an entry level nurse should know, and every condition that will be tested on the exam is from your approved nursing med-surg textbook. Every med-surg textbook have the same disease condition they want entry level nurse to know. The only time you are going to see a different condition is when you start working as a nurse. Then you might not see those conditions in your textbook. You learn about those conditions when you are working as a nurse. That is it. So, except if there's a new condition that have been added, and then each textbook start making new edition and they added all these conditions to the textbook. But aside that, every med-surg textbook that is approved for nursing school have every condition that NCLEX is testing. So when you go on the NCLEX exam and you are like, oh, I saw a particular condition that I've not heard in my life. Most time I just laugh at those students. Do you know the reason why? Because the reason why you did not hear about that condition is, one, you did not pay as much attention to med-surg in nursing school. That is one. Two, you practice question bank that barely test even 100 disease condition. Out of more than 200 disease conditions you should know in nursing school related to med-surg. So you barely even answer 2,000 question bank question that barely test 100 disease condition. Most especially, most question bank did not even test up to maybe 70 or 50. Right? And then you want to go on a particular NCLEX exam that have different questions for different students. You might not get condition that you are familiar with. Imagine maybe you are in a particular center that more than 10 students are taking the exam. Guess what? All of you question will never be the same in that exam. So if a particular student is getting familiar condition, you might not get familiar condition. You might get some ones that you've not studied. Because NCLEX have different conditions for different students. So the exam don't give students the same question. That's what you need to know. So if you want to prepare for the NCLEX exam, you should come well prepared. And the way to come well prepared, you need a strategic way to study. That's why I walk students through a clearer way to study and pass the exam. Am I making sense? So yes, that is what you want to think about, right? So now, if you have done your studying related to GI, you would have studied this condition. It's very common. NCLEX don't test condition that you should not know. They test condition that you should know. Now, let me tell you the truth. If you have a condition by any chance, you don't know it, right? Maybe you've seen it, you just forgot about it. Maybe I can really say, okay, that's a good excuse. But if you've seen a particular condition and truly, you've done all your studying, and trust me, you did not still know that condition, not that you forgot about it, you don't know it, it means that the NCLEX is not testing related to that condition. The NCLEX is testing related to something else. I've seen this as well too on the exam, so I can really say, yes, that is true. Sometimes you think the NCLEX is testing on that condition, you don't even know about it, but guess what? It's not the condition that NCLEX is testing. But the truth is, 95% of the condition you will see, I've not seen any condition that I don't know. Most time I ask my students, what condition do you see on the NCLEX exam? Even the one they struggle with, I know about it. So the truth is, we don't just pay attention to study. Most students don't like to study, right? So they just pay attention to the little thing they can study and just move on, and hoping that will help them to pass, right? Most students it help them to pass. Most students it don't. So you don't want to be in the position of trying to gamble yourself out, right? So that's why you need to start thinking like a nurse that will pass the NCLEX exam in minimum question, right? That's how we want to do it. So now we know what the body is saying. Remember, I said NCLEX have three parts: the body, the stem, and then we have what? Our answer keys. Now look at it. The body, stem, answer keys. Now, what's the stem asking related to? Because right now, what we are doing right now is to teach a client about their condition. And remember, the NCLEX is not just saying their condition. The NCLEX is talking about newly diagnosed. there's difference between newly diagnosed and condition. Newly diagnosed is that this um client need to know something special about managing their condition. But when they just list, when NCLEX just give you that condition, it means that this kind of patient is used to their care. There's nothing special right now that we want to teach them. We just need to manage their general care. But what is special about diverticulosis, right? What is special about diverticulosis is that we need to teach them that this is the problem they're going to be experiencing. And in order to avoid complication, they need to be on diet that don't cause what? Constipation, right? Constipation. They need to be on diet that don't cause constipation because we want to avoid rupture or furthermore problem to these pouches. So we this is the biggest thing we are trying to avoid for a newly diagnosed patient. So that's how you read question. Okay, a patient that have been on the unit for long period of time related to this condition, and a patient that is newly diagnosed. What do you teach a patient that is newly diagnosed of a particular condition? What is specific about a patient that is newly diagnosed of a particular condition? Right, all these things, trust me, you have to figure it out yourself. But if you join my coaching program, you don't have to figure this out yourself because I've provided you the information in my coaching program. All you just need to do is join, follow the process, and you pass, right? But if you decide to do it yourself, trust me, you'll go through this stress. You are going to be overwhelmed because during my time, I was overwhelmed of this process as well too. But now I now know everything and I've been able to put it together for you to be able to succeed, right? I've put it together for you to be able to succeed. And I always used to tell students this, right? Most time we think everything we need to do it by ourselves, but the truth is that everything you don't do it by yourself. Sometimes you need somebody to just walk you through the process. You need a structure, right? A roadmap that will clearly walk you through the process. If you are sick, right, you need what? A doctor, right? If you like when you were thinking about becoming a nurse, you needed your nursing school program. If you did not pass through a nursing school program, guess what? You will not be thinking of taking the NCLEX exam now. You know, most students end up what? Taking the NCLEX exam, even passing. I know about a particular student who took the NCLEX exam, passed, but they did not release their license because the nursing school program, maybe there was problem with it, right? So they did not release their license. So this student passed the NCLEX exam, but based on the nursing school maybe structure, they had to um they uh they did not release the license, you know. So since they did not release the license, she cannot practice despite the fact. So nursing school is important, and that was our thinking process earlier on. Oh, I want to become a nurse. She gained admission to a particular nursing school. Now she took the NCLEX exam pass. You can see this is important. Sometimes when in life we need support, we need guidance, because in order to make the process not difficult, if you do it yourself, trust me, you will meet challenges. But if you do it with somebody and they walk you through the process, it's not going to be difficult, right? That's why they always used to say two word is better than one, right? Now, so yes, that's the thinking. Now the examiner is saying which of the following information should the nurse include. So we are trying to include a specific information to this teaching related to what? A newly diagnosed what patient. Right? So now I've told you the thinking process, which is what? Constipation. Right? So if you look at the answer, now you can still understand the question too, even without not even understand. If you just know basic knowledge, you can still understand the question. Like, because I'll give you basic knowledge and I teach you how to figure out the answer yourself. That's the reason why students go on the exam and they are like, favor God bless you, favor God bless you. Let me tell you why they always used to say favor God bless you. Now look at it. If I give you the thinking process in a way that you can understand your diagnosis, and then you have, you know, it's GI and you know the pathophysiology. Now if this is the only thing you know, now let me tell you how you can figure out the problem, because initially I would have taught you about everything related to GI so you can easily think. So since we know this GI, every answers related here should be, your thinking should be related to GI. Now what does fluid, because NCLEX is saying we should limit fluid, so ask yourself, what does fluid do to GI? Ask yourself that one question. Obviously fluid helps us to avoid what? Constipation. So we are thinking about constipation. So we are now going to ask ourselves, why are we going to limit fluid related to what? Constipation, right? Limit fluid when fluid can help with constipation. That's what you are thinking. Sorry. You are going to ask yourself, why do we limit fluid when fluid can help us with constipation? So you know about this condition earlier on, you know it's the pathophysiology, you know the GI, you know the safety concern, which is constipation. So definitely we are not going to limit fluid because we want to avoid constipation. So why are we going to limit fluid? So this will be like a red flag to us. Now look at this one. It said you may be prescribed a bulk forming laxative. So what does laxative do? It helps us avoid constipation. So this look like a perfect answer now. But let's look at the remaining one. It said limit your intake of dairy products such as milk and yogurt. So what does milk and yogurt do related to GI? This cause what? Diarrhea. So at least milk and yogurt prevent constipation. So right. So the NCLEX telling us to limit it is a red flag. We don't want to limit it for a patient that if they have constipation, it can be a problem. You know, the safety concern is that we are trying to avoid the pouches from getting rupture, right? Because if you have constipation, stools start getting stuck into it, it become a problem. It gets more inflamed and it rupture, and it become a problem. If the stool start leaking into the GI cavity, it become a big problem. Peritonitis is a big problem, right? So we don't want that. You see the safety concern. You see what we are trying to avoid, right? So we don't limit, right? So this is wrong. Now you should avoid consuming cooked vegetable. No, that is also wrong. We don't avoid it. Vegetable as well to help your GI movement, right? It also help you avoid what? Constipation, right? So we don't avoid it. That is wrong. So now automatically you can see your answer to this question is 2. So you see how the NCLEX work. You see how you can easily break question down when you have a clear understanding. Now if you notice, if you are following me through this question, there's one thing I gave to you, which is the knowledge. You remember I said content, content plus knowledge, right? Plus question plus strategy equals success. Now I gave you the content, I gave you the knowledge. You see, I walked you through. Now it look like even just these few minutes I've been with you now, you might start feeling like yes, you have the ability to pass the exam. Now you will start noticing that you have the ability to break down question because I gave you a roadmap. Most students, when they see question, they don't have a clear way of answering the question. But look at what I did. I gave you a pattern. I gave you a roadmap. I gave you a movement. I gave you a dimension. I gave you a thinking process. So we thought through the body of the question together. Then we understand what? The stem. So we now know what the examiner is expecting of us related to the answers. So we broke the answers individually, and now you are not seeing like, wow, so this is how I can clearly understand the question even without overthinking. You can see we never had to what? Bring any information to the question. A lot of students will overthink and start thinking about extra information. They will say, oh, if they say we should limit, maybe it's because of this. There's no maybe it's because of this. You need to know what is related to the question. Always your thinking must reflect back the question. Your thinking is not what you are bringing into the question. Your thinking is what is already on the question. You can see. So yes, this is the transformation I want to give to you. And trust me, if you can learn this under few minutes with me, trust me, imagine what you are going to learn if you spend 60 days with me. Imagine what you are going to learn. Imagine the transformation you are going to get. Imagine it. Because if you can follow this same process under me, under 60 days, I can guarantee you are going to pass. You know it yourself. You know the answer already. You definitely know, oh, with the way this guy broke this question, you definitely know, you are saying it to yourself that, wow, he's going to be able to help me pass because he knows his stuff. And it's not about me knowing my stuff, it's about making you know the same thing. And I did not only attempt the question, because most people will attempt the question based on their way of answering question, but I walked you through the process. You see what I'm trying to give to you. I make you feel part of the process. I make you be the thinking. So we're thinking about it. It looked like we are doing it together. So you were thinking about it. It's not that you are trying to wait for me to answer the question. I walked you through the process. We're answering the question together. We're thinking about it together. I did not just answer the question. I walked you through the foundational thinking. I walked you through. I had to know virus sign. I had to know the 10 body system. I had to know assessment related to this. I had to tell you that I need to know the condition and the pathophysiology, the body system affected. I had to walk you through this process. Now imagine doing this every single day. You'll be filled with every information you need to succeed on the exam. It will be impossible for you not to pass. It will be difficult for you to fail. So let me give you this transformation, right? Just for $497 for 60 days. definitely you are definitely going to be able to what pass. So I still want to make the process easy for you. If you are unable to pay this amount in full, most students pay it in full, most students pay using payment plan, right? You can also reach out to me by putting down a down payment of what, $250, and tell me when you're going to pay the other $250, right? All this to give you the transformation after 60 days, which is taking you from I struggled before and now you pass, from I don't feel nursing is for me and now you are licensed. Imagine, right? So reach out to me, +1 767 613 0769. Right. I'm waiting for your text. So text me right now, +1 767 613 0769, and I'll be ready to help you pass the NCLEX exam in 85 questions. See you in my next video.